It's sad that last week in our deaf community, we lost two of our members to suicide, and it's increasing. I don't know by how many people. It's a tough topic to discuss. Negative self-image, it's depressing. People are upset, they're scared. It's not an easy discussion to start. Around 25% of people kill themselves by suicide, and they've never told anyone that they were considering. No warning signs were shown, and it causes shock to the people who are left behind. We can't help them. We have no idea that they were even considering it. The other 75% of people, when looking back, you see the warning signs in their lives. They've reached out before to other people, and they've shown continued depression. They've talked with people, gone to hospitals, maybe had mood swings, maybe they increased drinking, gave away most of their possessions. If they were involved in many different organizations, they took a step back, and people were able to, when looking back, see the warning signs. We need to start a clear discussion without using negative language and saying things like, "We wish you were dead." We need to tell them that their family and the confusion of what happens when they die. You need to ask more questions. Ask them for their story. Ask them when they say something like, "I want to kill myself. Do you mean it?" And if they blow you off, "Oh no, I would never do that. I would never." Frequently, when we hear things like that, we are afraid to ask ourselves because we think we'll give them the idea. But they already have the idea. We're not putting the idea in their head if we ask questions. By asking them, we're giving the validation. We're telling them that we care. They say, that they refuse and they would never kill themselves. Continue to ask questions. Ask how they were contemplating. Were they going to overdose? Did they have the medication already? If they were going to use a weapon, do they already have the weapon? Have they made the plans? Are they serious about what they're saying? Or is it just the cry for help? Ask them if going to see a therapist, going to a hospital would help. And if they say no, ask them, their feelings. Tell them that it will be confidential. You're not going to tell their family and friends. It's a hard situation to be in, but it's a very serious, it's life or death. You can't keep that confidentiality. You need to keep the conversation going and possibly break the privacy so that they will not injure themselves or injure other people. If you feel it in your gut and they say, "Oh, no, I won't," but in your gut you feel differently and you have that trust and they refuse help, contact their family and friends. Maybe you'll be worrying all night and the contact will go through their minds. Contact the police. If you live far away from the person, contact their police in the area and let them know the address so that they can call and do a check-in. Many people, they don't want to call 911. They think that they'll be mad. Their friend will be mad if that happens. But which do you prefer? A mad friend or a dead friend? If they're mad, later on as time passes, they'll realize that you cherish their friendship and their life, and that anger will go away. Going to a hospital and discussing with a doctor or a therapist, there are deaf services. Some have, some don't. But counselors? We don't necessarily have deaf counselors, but you can go. The issue will continue. Our community, we have to fight. In Colorado, there was a deaf lawsuit for health services, inquiring for more improvement of services. And not enough, so they realized, we can't push it aside and just have friends and families doing the work. It's better than nothing. But we need to continue to fight. Sometimes we can't prevent people from killing themselves. But it's our job to spread the news and know what to do if someone does want to kill themselves. It's not our fault. And it's important that you remember that. If you see a person who needs help, try to help them. Don't let that opportunity pass.